Hello, everyone. My name is Maria Nunez, and I will be talking about the different roles of the clinical nurse specialist. And one of them is the direct clinical care, which is an interaction with patients, families, and group of patients to promote health or well-being and improve quality of life. The clinical nurse specialists are considered being very skillful and expert in clinical thinking. So usually they focus on patients who have a complex diagnosis or patient who needs a complex care. They usually do a full assessment, like more detailed assessment when there is a problem. For example, if there is a patient who is diabetic that is not compliant with the medication, they're gonna do an assessment not only focus on the patient and the disease per se, but also they're going to consider another factor like the socioeconomic factors of if the patient have any support system. Also, the clinical nurse specialist are going to facilitate the interaction with multiple individuals or multiple disciplines. That's when the collaboration take place. Collaboration is working with others in a way that promotes, encourage each person's contributions toward achieving optimal, realistic patient and family goals. Mentioning the same patient, like diabetes patient, as we all know, diabetes is a disease that the management is multidisciplinary. We need the nutritionist, certified diabetes educator. As a nurse practitioner, we will need an endocrinologist, which will be the collaborating provider. Also, we're going to need another specialty like the podiatry, also the ophthalmologist that are going to evaluate the patient to see if have developed any chronic complications. The other role that we'll be talking about is the guiding and coaching the patients. Coaching and guidance are very important in providing and influencing the patient and family education. It complements the care given to a patient and family by other health professionals. And there is a lot of resources now in the internet that you can use to teach and educate the patient. A lot of websites and group support. The other role is the leadership opportunities for clinical nurse specialists. They serve as leaders of multidisciplinary quality improvement teams, evaluating practice and changes in a complex healthcare delivery system. The clinical nurse specialist has the responsibility for clinical innovation and change within the patient care system, identifying the needs for practice changes and leads the development and implementation of clinical procedures, practice guidelines, and clinical pathways designed for care improvement. The clinical nurse especially are unique, very educated, that provide advanced practice and specialist expertise when working directly with complex and vulnerable patients, educating and supporting interdisciplinary staff, and facilitating changes and innovation in healthcare system. Thank you.